Elle Macpherson just announced that she's had a very private 7-year battle with breast cancer. She was diagnosed with ductal carcinoma in situ, and her oncologist recommended an immediate mastectomy, followed by chemotherapy, radiation, and finally a breast reconstruction. But did she follow the oncologist's advice? Heck no. Instead, it says she spoke to 32 different medical experts and came to the painstaking conclusion that she was going to use a holistic approach involving herbs, meditation, and mental wellness to treat her ductal carcinoma in situ. That decision, as difficult as it was, might be very detrimental to her overall health, as well as to the general public, especially patients recently diagnosed with breast cancer who are trying to make a rational decision. It's gotten the oncology community up in arms, the American Cancer Society, and also a lot of the current patients suffering with breast cancer. And we're going to get into that today. Hi, I'm Dr. Messina, and there are certain areas of her case that just don't add up. And we're going to discuss that. Also, at the end of this video, I have a very special announcement for people who are just diagnosed with any type of cancer, or even if you have a family member going through it. So make sure to watch to the end. She was diagnosed with ductal carcinoma in situ, which is really stage 0 cancer of the breast. Say it again, what is that type of breast cancer she has? That's ductal carcinoma in situ. As the name implies, it's involving the milk duct. It's a carcinoma, so it's malignant. In situ means it's a tumor that's in the place that it started. It hasn't become invasive and it hasn't spread. It's still completely inside of the duct. Once it spreads out of the duct and becomes invasive, and now it's in the stroma of the breast, you're into stage 1 breast cancer, where now that tumor can get into the lymphatics and travel throughout the body. Ductal carcinoma in situ is usually not found by palpation. In other words, patients don't feel their breast and suddenly notice, oh, I have a density or a rock in there. Instead, it's usually discovered during routine mammography. And the mammogram will show a cluster of abnormal microcalcifications. That should make the suspicion that you have a malignant lesion developing in that spot. Now, some people might have some symptoms. They might notice that the skin around the nipple has become dried and chafed. They might also have some discharge from the nipple that could even be blood-tinged, if not outright bloody. How do you get diagnosed with it? To make the diagnosis, you need a tissue sample. That's usually done by something called needle localization. Using radiographic data, they can determine exactly where in the breast that microcalcification cluster is. They then insert a sterile needle up to it that's graded on the side. The surgeon will then excise the tumor around the tip of that needle and send it to the pathology lab. They might actually put a suture in it or two. They might put a blue suture on the lateral edge and maybe put 2 sutures on the inferior edge. And when they send it to the pathologist, who's going to examine it for not only what type of cells are there, but to see if the abnormal cells have a clear margin of healthy tissue around them. And they will use those sutures to tell the surgeon, you need to take a little more tissue out of that lateral border or that inferior margin. And they're going to know that from the way the surgeon marked it when he took the specimen out. Many times, doing this, which is essentially a lumpectomy, is enough to treat DCIS. When the pathologist receives the specimen, they're going to look for 3 things in general. First, going to measure the size of the tumor. They're then going to look at the cell structure. Cancer cells stem from another cell. The closer in appearance to that cell that they came from means that it's well differentiated, and it's going to mean that you probably have a slower growing tumor. It's going to be a little less aggressive. If the cells are very poorly differentiated, where it looks nothing like the tissue it came from, then you have to be concerned that you might be dealing with a more aggressive tumor type. And that's going to change your treatment plan. And then finally, they're going to look for receptors. Now, in Elle's case, she had DCIS HER2 positive tissue. That meant that there were receptors on those tumors that were receptive to estrogen, and the addition of estrogen would basically help the tumor thrive. Therefore, by starving it of estrogen, you could theoretically starve the tumor of some of its energy and help destroy those tumors. And using those three parameters, you're going to get a treatment plan. The treatment plans could go as follows. If you have a small tumor that's very well differentiated and receptor negative, you might be able to do something called active surveillance. You could follow that along, provided you truly believe that it's going to be very slow growing and has a low incidence of going into the later stages of breast cancer. But you're going to have to watch that thing probably every couple of months. Sometimes just doing the lumpectomy is enough. We don't really do mastectomies anymore for DCIS. That's one of the things that bother me in her story. If her oncologist said, we recommend a mastectomy, that's kind of out of the current guidelines. And then depending on how well differentiated the tumor was, you may or may not add radiation therapy. And when they radiate the entire breast, not just focusing on that area where the calcifications were. The reason they do the whole breast is because when DCIS spreads, it kind of spreads similar to where if you had a paintbrush, pulled it back and let it splatter on a canvas, you might get shotgun spread along that breast. Therefore, when they radiate a breast for DCIS, they radiate the entire breast. Why would somebody want radiation therapy? I heard that's terrible. Well, there are a few instances where DCIS is going to need it. One, if it's greater than 2.5 centimeters. Two, if it's very poorly differentiated, in other words, a high-grade tumor. If there's any necrosis or dead tissue mixed into the tumor. And if the surgical margin is less than 3 millimeters of healthy tissue. And radiation therapy reduces the risk of recurrence in half. The risk of recurrence, even when resecting a DCIS tumor, is about 30%. And of that 30%, half of the time it's going to come back as a more aggressive tumor. The other half of the time it's going to stay as DCIS. By taking the radiation therapy, you cut that in half too. So you decrease your risk of getting a more invasive tumor, if it should recur, down to 7.5%. And that's why people might get offered radiation therapy beyond doing a lumpectomy. And finally, in her case, they might decide to use an aromatase inhibitor, either a tamoxifen or a Remedex, to suppress the estrogen. Like I said, when you have estrogen-positive cells, by suppressing estrogen, you can actually help harm the tumor. The other thing that I found disturbing was her oncologist wanted her to have chemotherapy. And if you noticed, I didn't mention any chemotherapy. The reason being is DCIS does not respond to chemotherapy. You do not use chemotherapy for DCIS. The fact that her oncologist said it makes me worry that maybe there was more to her situation than she actually understands. The way this hurts the community in general is we're going to have a population of people recently diagnosed with breast cancer who are trying to make a decision, and people who are already in the middle of getting chemotherapy for their breast cancer, and they're thinking, why am I so darn sick every day when I could be taking these herbs and spices and this wellness treatment that Elle got and be just fine? One of the things that's disturbing is the media is not putting out the true picture. She didn't just have a naturopathic method. She basically had a lumpectomy. That could be all she really needed to obtain that 99% 5-year survival. And from what I saw in her data, that and maybe reduction of estrogen with tamoxifen or Remedex, that could have cured her just as well. And that overriding any benefits that she could have gotten taking the naturopathic method. It really wasn't naturopathic. The other thing is when you look at some of the articles and what she said, she just didn't go to the GNC store and buy some ginger root and some paprika. She went to the best of the naturopaths. She spent weeks at a wellness center and a wellness clinic. She got naturopathic treatment that the average person is not going to really be able to avail to themselves. So even if there was something to this naturopathic therapy, it's really not going to be available to the average person. Now, this is the part for anybody who might have somebody being treated for cancer, if not yourself, or anybody you know. Basically, it starts with a phone call. And you hear at the other end, the biopsy report was positive. Come to my office tomorrow, we have to talk. When you go to the office, they're going to lay out a plan for you. And they're going to say, this is the type of tissue you had. We're going to offer this chemotherapy, and that chemotherapy. And that chemotherapy is going to make you pretty sick, but you're going to have about a 98% chance of 10-year survival. Now, we can do this chemotherapy, and this chemotherapy, and you'll have about a 95% chance of survival, but you won't be as sick. And then finally, we could offer you these, which is not going to make you as sick, but you're going to have about an 89% chance of a 10-year survival. And you're going to get confronted with all this information. You're going to have to make a decision fairly quickly. And that decision could change the course of the rest of your life. So it's important to understand the amount of emotional and mental stress that goes into a person planning their treatment. So we can't look at a person like Elle Macpherson and poke fun at her or say, how could she have chosen such a path? I think it's crazy. Well, you might think it's crazy, but it gives her solace. And it's very important for a cancer patient to feel that they've done the right thing. You can't really judge anybody with it. It's very personal, and the decisions are profound. So all I think we should do is hope that she does the best. She says that she's in complete remission now. Let's hope that she stays that way for the rest of her life. Take care, and I hope you learned something about DCIS breast cancer. If you do like my medical videos, then click subscribe and hit the bell to be alerted to the future videos. I wouldn't mind a good thumbs up, and I'll catch you at the next video.